Dr. Madeline here at Forward Spine Center. Today we are going to dive into carpal tunnel. Carpal tunnel is the most common nerve entrapment syndrome. It affects 3 to 16% of the population. It's more common in females. It usually peaks around the ages of 45 to 60, and it is common with repetitive movement or stress, such as repetitive wrist flexion or extension, wrist movements such as holding our cell phones or laptop use. It's also increased with vibration. Risk factors include diabetes, pregnancy, hypothyroidism, and a number of other different health risks that us doctors here at Forward Spine Center take in consideration when we are diagnosing carpal tunnel. It is caused by compression of the median nerve that flows through the carpal tunnel. This compression can cause numbness or tingling or pain in our hand. It often also causes motor loss, such as dropping or clumsiness of our hands. 77% of carpal tunnel patients also experience symptoms more at night or right away in the morning. When treating carpal tunnel, we start off by evaluating the cervical spine. We may look at the scalenes, the pectorals, and then we make our way into the shoulder, possibly evaluating shoulder dysfunction, making our way into the elbow, checking notably the pronator teres. Pronator teres syndrome is present in 12% of the patients that are experiencing carpal tunnel syndrome. So we evaluate the elbow, the pronator teres, and then we make our way down into the hand, the wrist. We check range of motion. We look at the wrist and the hand. We check for swelling or color changes. We perform tests that may reproduce the symptoms. We rule out other diagnoses such as osteoarthritis, cervical radiculopathy, and pronator teres syndrome. So today I'm going to go over a few stretches and exercises that we recommend here at Forward Spine Center to carpal tunnel patients. However, each case is individual. So depending on your symptoms, we may include more cervical spine stretches, more stretches down into the shoulder. We may evaluate the shoulder to make sure that you're dropping that shoulder back, and then also making our way into the elbow. So the first exercise that we're going to go over is finger spreading. So if you have a rubber band, you may have a hairband, or often you can also buy these fancy wrist finger spreaders on Amazon. But today I'm just going to show you with a rubber band, and you place that rubber band around your fingers and you just spread them apart. You're going to perform this 25 reps. You may notice when you get to 25 how weak your fingers are. We often perform a lot of gripping and a lot of wrist flexion, and we need to work that extension. The next stretch we're going to go over is a scaling stretch. So you're going to sit or stand up really straight. You're going to place one hand underneath your thigh. Standing up straight, you're going to bring your opposite ear to the opposite shoulder. You're going to place that opposite hand onto the side of your face, gently pulling down, going into lateral flexion. When you reach that peak spot, you're going to go into lateral flexion, bringing this ear to the shoulder, pressing against your hand. For 5, 4, 3, 2, 1, resting and pulling. You're going to feel that stretch along the anterior scalene, the front of the neck, down into that shoulder. Good. The next stretch is the medial nerve glide. So we're going to perform this seated as well. You're going to tip your head towards the affected side, dropping your shoulder and arm down. Reach your hand back, extending your hand. Good. Now you're going to flex your hand forward and then reach your head towards the opposite side. Perform 10 to 15 reps, gliding that medial nerve. The next stretch we're going to go over is really working into the forearm. If you have a foam roller, I have a fancy little massager. Placing that down, you are to glide along the forearm, massaging those muscles. When you find a tender spot, you're going to perform wrist flexion and extension, notably wrist flexion. Massaging if you are experiencing carpal tunnel syndrome, this will be tender, your forearm. So we want to massage that area. Good. If all of these are feeling good, once we get to the end of the care, we want to really make sure that we're strengthening your extensors. So the next exercise is with a weight. You're going to find a spot. You're going to rest your forearm onto the table. Assistedly, you're going to flex your fingers towards your face, your wrist towards your face, and then you're going to slowly lower that weight down. You're going to feel these muscles along the top of your forearm really fire. assisting that weight up, and then lower slowly. Good. Performing 5 to 10 reps of this, again, on both sides. Good. Along with exercises and stretches, at-home care is often included in our treatment, avoiding repetitive stress that is causing this carpal tunnel syndrome. Activities such as push-ups, cycling, or yoga may be limited for a short period of time. And then braces may also be recommended, however, for a max of 6 weeks. Possible blood work recommendations, including evaluating B6, B12, and vitamin D. Again, if you or anyone you know is dealing with carpal tunnel, please send them our way. Dr. Madeline, thank you for allowing me to be part of your health journey.